and welcome to Serenity Birthing, your birth and beyond the way that resonates with you. I'm Shelley, the Serenity Doula. We will start with Module 1, Physical and Mental Preparation for Birth. I'm also going to go over what we're covering in all the other modules, just so you have an idea of the module content. By following the modules in this course, I'm hoping that you will have a birth experience that you will feel empowered by. Becoming a parent is an absolutely wonderful experience, as long as you feel that you understand your choices and rights, you understand and know what is going to happen in labour, that you feel that you have made choices rather than choices being taken away from you or decisions made for you. Feeling as if you have some control over the situation can be helpful. So having an understanding of what is happening to your body and why, and also knowing in those early stages of when the baby is there what's normal, so that you can feel nice and relaxed and just enjoy the time with your new baby. As we go through the modules, we are covering lots of different things. The modules are hopefully in bite-sized chunks, though some of the modules, I have to admit, are big bites and some are smaller. Start off gently with Module 1, which is quite a short module, on birth preparation, physical and mental. So this is just preparing yourself for birth, having a think about the things that are influencing you around you, and things that you can do to help yourself feel very positive about your experience to come. In Module 2, we will cover birth physiology, anatomy, and the path to birth. Now, don't worry if you aren't sure what these things are. I'm going to go over in very simple terms, just so that you understand what is happening in your body. I think this can be very helpful, so that during a new experience that you may not have had before, knowing what is happening can just help you to think, oh, okay, that's what's going on. All right, I can relax about that, rather than thinking, ooh, what was that? Is that meant to happen? Oh, not sure about that. Module 3, we're going to talk about where to give birth and why. Now, it's important during labour for you to feel relaxed and safe. So it's important to take a little bit of time to think about where that would be for you. Now, everybody's different, so it may be that you would feel safest surrounded by lots of people with medical knowledge and machines, or it may be actually that you would prefer to be at home, somewhere quiet and safe, your special place. Module 4, we're going to cover optimal fetal positioning. Now, that can sound quite sciencey and technical and a little bit strange. It's just fancy medical terminology for getting your baby in the best position to be born. So we'll just talk about a few things that you can do at home in the last few weeks leading up to birth to try and help your baby into the best position, and explain why it is the best position and how it can help your body during labour. Module 5, your amazing journey through labour. So we're going to go through all the stages, what to expect, how you might feel, things you might like to do, things you can do to help yourself to feel more comfortable. Then we'll move on to Module 6, your first days as a parent. So this is just covering what you might expect your baby to be doing in the first few days, behaviours you might notice, number of wet and dirty nappies so that you know they're getting enough to eat, all that sort of thing, just so that your mind can be at rest and you can just enjoy that time getting to know one another. Module 7, we're covering the 4th trimester. So I think we probably all know that during pregnancy we have 3 quite separate trimesters as the baby is growing. And there's a school of thought that believes that really those first 3 months after the baby is born should be counted as the 4th trimester. where you should be snuggled up, just getting to know your baby, getting feeding established, bonding, and just really spending all that time together, just loving with each other. Module 8 is what to expect from medical staff. So this is just to give you an idea of knowing what the medical staff might like to do when you go into hospital, the things that they may say to you, but also things that you might like to say to them, so that you really feel that you're in control of everything that's happening, that you understand why everything is happening, that you can say to them, "Oh, do we have to do that right now, or can we wait a little while?" So it's just a few tips and techniques of things to just make the labour go smoothly and your time with the medical staff go really well. So the whole team, you and the medical staff, and if you have your doula with you, just helping to make everything go smoothly and be as relaxing as possible for you. Module 9 is all about induction. So we're going to talk about the process of induction, what it is, and also the pros and cons for induction and the pros and cons for maybe choosing not to induce and just letting your body go into labour naturally. Module 10 is about pain management. Now this has detail about all of the options, both pharmacological, so medication or drugs that you can have and where you can have the different options, but also natural things that you can do to help manage sensations during labour. This module goes through all of the pros and cons of them as well, and there are links on my website for studies into effects of pharmaceutical pain medication on both you and your baby. So it means that you can then make an informed choice as to which pain management you use during labour. So when you say yes to something, you know exactly what you're saying yes to. And I think that helps you feel much more confident about your decisions, which is what we really want. Module 11 is all about assisted birth. So I want you just to remember here that the requirement for assisted birth is actually very low. So don't worry if you're looking at this module and panic about anything that's in there. It's more just about when these things might be needed, when a little bit of help to get the baby out might be needed, what to expect when that happens, things that you can ask, just to give you an idea, because we want you to be calm no matter how your baby's born, and just having an understanding of what might go on can help to do that. Module 12 is Serenity Birthing. So in this module, this is the big one, so set aside a little bit of time for this one. We talk about hypnotherapy, coping strategies for labour, including breathing techniques, massage techniques, and how we can prepare you for birth. Module 13 is about birth companions. So this is the ins and outs of birth companions, what makes a good birth companion, things that your birth companion needs to be able to do for you, just helping you to make the decision of who you have accompanying you during your labour. So you may choose to have a partner or a friend or family member, perhaps even a doula, like me. There's lots of research to say that having somebody with you the entire time when you're in labour, just supporting and looking after you, really helps labour. It can make it shorter, it makes the chances of needing any kind of intervention or pain medication far less. So this is an important thing to think about if you would like somebody with you. It's also helpful for birth companions so they know what to expect, so they can be calm and relaxed and just spend the time supporting you during your labour. Module 14 is the wonderful art of feeding your baby. So in this module I talk about breastfeeding, that special hour after you give birth, and how important it is to be skin to skin with your baby as much as you can, but also not to worry if this can't happen for any reason, because there are lots of things we can do to help that bonding and that feeding get established. So module 14 covers this. It covers the ins and outs of breastfeeding, positions, how to get a good latch. It also covers different positions, good latching technique, safe co-sleeping, safe swaddling, and safe baby carrying. We talk a little bit about the stark differences between breastfeeding and formula feeding, just so that you can have all the information to make a decision that you can own and feel happy with, whichever way you choose to feed your baby. Module 15 is formula feeding, so it covers the safety of making up formula, how to do this correctly, following guidelines. It's just the ins and outs for that final module. Okay, so let's start module 1, what you will encounter. First of all, it's good to have a little think about how our family and friends and our culture may influence us and our thoughts around giving birth. Perhaps your family delight in telling you horror stories, or perhaps your friends are telling you all about the wonderful calm births that they've had, and so you're looking forward to the day. I'm going to talk about any preconceptions you might have around birth. Perhaps you've been watching television programs and have seen lots of births on there and have an idea of what it's going to be like. Perhaps you've read some books about things to expect. I'm going to talk about emotions that may arise when you think about birth. Perhaps there is excitement, maybe anxiety. Maybe you're feeling very fearful about giving birth. I'm going to talk about all of those and things that we can do to make sure that the emotions before the day are very positive, so that you're really looking forward to the event. Make sure that you're feeling confident, so you understand what is going to happen and know your rights, so that you can go in feeling really empowered. Because giving birth can be the most wonderful, empowering experience. You're becoming a parent, which is amazing. Now, when you're pregnant, you're in a state of light hypnosis due to the hormone balance of all of those lovely hormones flowing around your body. So it is very important to protect yourself. So if somebody is about to tell you a birth story, maybe just stop them and say, "Can I just ask if this story has a positive message?" You are absolutely okay to say, if they say, "Oh no," to say, "Actually, I don't really want to hear it, thank you very much. Perhaps after I've had my baby we can talk through it, but right now I'm just trying to keep myself in a lovely happy bubble. Think about positive birth stories." Avoid watching birth documentaries. Now, I know a lot of us get addicted to One Born Every Minute and other birthing documentaries, but I just want you to remember that they are a drama. They are not reality. It would be frightfully boring if everybody had very relaxed, laid-back births and nothing dramatic happened. Doesn't make good TV, does it? So remember that they are a drama. They are not reality. They are also not your reality. Each birth is different. You are on your own journey, not somebody else's. So that comes to the next point, remembering that a story can only be that person's perception and feeling. So that's important, that all births are different, but actually each person's perception in the room of that birth will be different. Because different feelings and thoughts that are coming from you may be different to your partner, may be different to the doula that's present, different to the medical staff. All of our experiences in life form our thoughts, our fears, our anxieties, also our excitement, our wonder. Every experience that happened to us builds up how we deal with, how we think of new situations. And all of us carry our baggage around with us. for both positive and negative thoughts that come up with things. So actually it can be really helpful to take time during pregnancy to address any feelings of anxiety or worry or fear that you might have around birth, and also for your birth companion to do the same. That way you can go into labour feeling positive, relaxed and calm, which is absolutely what we want to do to get the best out of your body. Finally, we need to remember that Google, good old Dr. Google, can be very unhelpful. So if you are concerned about anything, please ask your doula or your midwife, who can point you in the right direction for research and links that will actually be helpful, or to people who can support you in the right way. Okay, let's go with positive steps we can take to having a wonderful birth journey. By the end of this course, I know that you will know and understand that birth is a physiological event. It is not a medical one. You were absolutely made to do this. This is what your body was made to do. It's meant to happen, and it's meant to be something that you can cope with. Everything that's happening in your body is a part of you. So how can we do that? Well, reading positive birth stories is absolutely wonderful. Surround yourself with positive birth information, such as this course, hypnobirthing books, audio files, birth affirmations. Join a positive birth movement group online and read positive birth stories. Now, there are lots and lots and lots of birth stories out there, lots of fantastic groups on Facebook. There are some links on my website, the serenitydoula.co.uk, that you can click on. And you will see that these positive birth stories come from all different kinds of birth. So not necessarily home births in pools, though there are lots of those, but also caesarean births, assisted deliveries. However you give birth, it can be a positive event. Okay, the next thing we need to do is address any worries or fears that you have surrounding pregnancy, birth and parenthood, so that you can go in feeling positive, empowered and absolutely ready for this wonderful adventure. So let's move on to a practical exercise. I would like you to take some time now to think of emotions that arise for you when you think about birth. Are they positive? Negative? Are these feelings associated with you and how you will be, or with others? Perhaps the thought of how your family are going to react, or your in-laws, or your partner. Do you have any specific fears about yourself, or your baby, or the others around you? Perhaps worrying about medical staff? Maybe you have positive feelings. I'd like you to write down between 3 and 5 emotions that come up for you. And then I'd like you to allow yourself time to just think over them individually. Write them down on post-it notes. We're going to address fears throughout the course by helping you to understand the process of birth and what to expect, how to avoid unnecessary discomfort, and also through letting go and relaxation exercises that we can do. It's helpful to have a diary. If you're one of my doula clients, you know I'll give you one of these. You can write down about this amazing journey that you're on. It's lovely to document your adventure. And I think it's really helpful, especially if you're coming from a place where you're worried to begin with, because you can see how your thoughts and feelings will change as you go through this course, and you get a greater understanding about birth and fantastic tools to help you to release those fears and let go and make space for positive thoughts and feelings about this wonderful journey that you're on to becoming a parent. So I'll leave you now to take time to write down those emotions, and I look forward to seeing you in Module 2.